It's important the public is aware of the critical role that research plays in the delivery of healthcare, particularly during epidemics.
During pandemics, patients die because we don't know how to treat them, or we give them the wrong treatment. And so there's only one way to know how to treat patients, and that is by doing clinical research.
The public want and have a right to an effective response. That response can only be effective if we know what to do. Knowing what to do is based on science. Research is central.
People often think research is only focused on producing papers or just new scientific breakthroughs that foster the career of researchers, without recognizing how it is an integral part of providing good service and improving health outcomes.
If we don't do research, we are blindfolded. We're working on the assumption we know everything we need to know.
The whole idea of clinical research is help acquire better outcomes for patients. And during a pandemic or an outbreak, that becomes extra important because of limited resources, for instance. You just want to learn as much as you can from an outbreak as early as possible to improve outcomes for patients.
You never want to be in the same situation twice. The next time we have an outbreak, I don't want to be caught with the same kinds of knowledge gaps that I had this time, because then I can't improve. So it's always important to try to do better each time you have an emergency.
I come from Central Africa, where there are so many Ebola outbreaks. So unfortunately, the teams, research teams, are not well prepared to respond to these threats.
Ebola has reared its ugly head again. Just this year, we've had 2 outbreaks. There's one ongoing right now in the Democratic Republic of Congo, in a very difficult area in the east. But earlier this year, there was another outbreak in the same country in a different area. And those 2 outbreaks on the back of the very large outbreak in 2014 suggests that perhaps the way that the virus is behaving is changing, and that we're going to see more and more outbreaks as time goes on.
There's a lot of fragmentation in the world in doing clinical research and in rapidly responding to infectious diseases outbreaks or to pandemics. And that's again something we want to discuss here for the next 2 days. We want to bring people together who are trying to struggle to do clinical research and to see how we can avoid this fragmentation.
This conference brings together a group of like-minded people who've been working on clinical research, but also epidemiological science and social sciences to tackle the same problem, which is outbreaks of infectious diseases. And there's now a number of groups have evolved over the years, and it's great to bring them all together so that we can learn from each other and support each other.
Prepare is an EU-funded project that runs for 7 years, from 2014 to 2021. And the objective is to prepare Europe for the next major infectious disease outbreak or pandemic infectious disease.
The idea of GloPedR is to try to coordinate research in the emerging infectious disease epidemic time. The idea is to create coordination between different funder agencies to be able to synergistically respond to an epidemic.
Unfortunately, I think research has almost gained a negative air about it over the years, and it's almost as though it's needing a rebranding, and that we have to maybe just explain a little bit more to the public about what we really mean about research.
The communication with the population is absolutely critical, and one of the things that you always have during these bad outbreaks is you've got the epidemic that's the outbreak, and then you have the epidemic of fear. And sometimes the epidemic of fear can be even more paralyzing than the epidemic itself, and it really gets in the way.
Managing a public health response to a really nasty outbreak, whether it's Ebola, monkeypox that we've had recently, or a pandemic, is a roller coaster, because you're trying to keep the public calm, and the politicians, yet get the right outcomes.
Populism actually devalues competence and brings forward ideas that are based more on the emotions and on the emotional perspective than on facts.
Levels of education and exposure all influence the way people respond to research. Traditionally, the ways in which researchers have acted in many parts of the world have made some people shy away from participation in research, because they see research as only taking away from them, taking their blood and talking to them for hours on end without any real benefit. They don't perceive any real benefit to themselves.
Well, we would like to increase the awareness amongst the general public about epidemics. So, for example, in Prepare, for our clinical studies, we have a public panel where we sent out an advertisement to members of the public in Wales, where some of our team are based, to join our public panel. And we meet on a quarterly basis, and we talk about infectious disease outbreaks, and we talk about particularly pandemic flu and clinical research. And that group are ready to give us feedback and information, if there were to be a pandemic flu, about how we design our research.
I think it's important that we do as much work as possible during the peacetime, so in the inter-epidemic period, in order to advance medicinal products. They can be drugs or vaccine, in order to make sure that when the pandemic or the epidemic will strike, we are as prepared as we can.
A good response to an outbreak contains it, treats the patients effectively with few or no deaths. And without science, how on earth will we do that effectively?